It elevates your practice. You're able to see patients in a way that you've never been able to see before. That ultrasound, that X-ray, radiographs, blood work. It just, you don't see that. And then when it gives you a 3D representation of your animal, of your pet that you're treating, it really helps you understand, the root cause of the issues. Just like with rabbit dentals, we would always use that to actually look for, why are we trimming the molars every 4 weeks? There has to be something that we're not addressing correctly, because the husbandry is spot on, and we were able to find, tooth root problems and be able to really help the problem itself. So we actually had about a 14 to 16 foot reticulated python that had rostral swelling of the maxilla. And we continue to do abscess surgeries. We were doing x-rays. We never saw any osteomyelitis, just because there's a lot of noise in there. And finally I said, after the third surgery, I said, let's, because they thought it was breeding related. They just kept rubbing on the cage. I said, let's do a CT scan, make sure we're not missing anything. And we actually found osteomyelitis in the maxilla. And we were able to perform surgery, remove the diseased bone, and the animal never came back for that issue. So that was great. We do a lot of lectures for the community. And to be able to talk about bird anatomy to bird pet owners and show them the 3D version of, like, this is a fracture and this is what it looks like, or this is what an air sac looks like, or this is what aspergillus, fungus looks like on infection in a bird in a 3D format. It allows them to understand. It helps the communication with the client too. So it just really brought us up to the next level.